This is a 35-year-old Tony Award winning composer, playwright in New York who essentially was seen in the emergency room and was diagnosed with food poisoning. He had some symptoms of nausea, abdominal pain, vomiting, not feeling good. He was sent home with a diagnosis of food poisoning. And a few days later, he went to another ER where he was diagnosed with upper respiratory infection. He goes home, and several hours later, he's found dead in his kitchen floor. Who's this celebrity? Who's this artist? Who's this playwright? Any idea? This is Jonathan Larson with the play Rent. In fact, the show for the first time was to be played on Broadway, scheduled the same day, the day he died. His parents were flying in, and essentially the play went on without him. And the newspapers in the next few days basically put this out. This basically says it's believed that if the aortic aneurysm had been properly diagnosed and treated, Larson would have lived. He had been suffering chest pains, nausea for several days prior, but the doctors at St. Vincent Hospital could not find signs of heart attack, so the misdiagnosis is either as a flu or stress. So of course there was no heart attack, it was misprinted, but at the end of the day, Jonathan Larson had aortic dissection, thoracic dissection, and that's how he died. And this is a statement that was a quote that was pulled out. It says, "There's no disease more conducive to clinical humility than aneurysm of the aorta. The tragedies of life are largely arterial." William Osler, that was his statement.